Learning objectives. Articulate, understand, and draw the shape of a sickle scaler in cross-section. Identify an improperly sharpened sickle scaler. Looking at a sickle scaler, determine how it has been improperly sharpened. Demonstrate and be competent at correcting an improperly sharpened sickle scaler. Articulate why it is important to use a sharp instrument. Articulate the cause and effect of using dull and improperly sharpened instruments. Demonstrate how to sharpen a sickle scaler to maintain its original design by using DH-Cube's approach. Directly apply the principles learned in this module to real-life work experiences. Required equipment: sickle scaler. We'll be using the Hugh Freedy Nevi 49. Sharpening stone, sharpening test stick, your loops, good lighting, gloves, lab coat 2x2 gauze, and the DH Cubed 110. Original design of the instrument. Why is it important to know the original design of the instrument? If you cannot visualize or don't understand the original design, you cannot sharpen it correctly, and you won't know if you have sharpened incorrectly. And you will not be able to recontour the instrument back to its original shape if you don't understand this key concept. Notice how the incorrectly sharpened instruments no longer have the same shape as the new instrument. Number 2 looks really good. The original design has been maintained. It's getting thinner, but still very functional. Number 3 still has the basic original shape, but from the middle section to the tip, it is getting very thin and risks breaking. This instrument needs to be discarded. Number 4, this instrument is very distorted, possibly even bent. It needs to be discarded. It is too thin and distorted to even attempt to recontour it. If the original design is not maintained, the hygienist will have to compensate their hand in order to adapt an instrument that is not shaped properly, potentially leading to work-related injury. This training will demonstrate how to sharpen the sickle correctly to maintain its original shape and design. There are several factors of how a poorly sharpened instrument affects the hygienist. 1 is causing bevels on the lateral surface. 2, working with a dull instrument, and 3, turning the stone in at the tip, causing the instrument to become short and ineffective in the interproximal. Notice how this hygienist's wrist is not neutral. She's trying to close the blade in the attempt to get the instrument to adapt and bite the tooth. This is either from bevels on the lateral surface and/or a dull cutting edge. This repeated action can lead to hand injury over time. Before we delve into sharpening, let's review the instrument design so you can begin to master sharpening of the sickle scaler. Looking closely, identify the face, the lateral surfaces, the tip, and the terminal shank. The cutting edge is formed where the face of the instrument meets the lateral surface. Similar to the universal curette, the sickle has 2 parallel cutting edges, but its cross-section view is different from the universal curette. As you can see, it has a triangular shape. The face is curved from shank to tip and is on the same plane, just like the universal curette. Unlike the universal curette, the sickle scaler has lateral surfaces that converge towards the tip, resulting in a pointed end. And in cross-section, the sickle looks like a triangle. Some sickles will have curved sides and some have straight sides. This is important to know because you will better understand the sharpening stone angle and what happens to the shape of the instrument if your angle is off. For example, in cross-section, visualize the correct 110-degree angle for sharpening the sickle scaler. Visualize what the shape of the sickle will be as a result of sharpening it at greater than 110 degrees. Notice that the back gets thinner while the face stays the same, and the back will get very sharp. Eventually, the integrity of the instrument can fail and potentially cause the instrument to break while scaling. Now, visualize what the result will be if your sharpening angle is at 90 degrees. The instrument will be sharp, but will not stay sharp for long, and it will require your hand to compensate in order to get the cutting edge to adapt. As the instrument gets duller, you will have to compensate even more with your hand by attempting to close the blade in order to get the instrument to bite the tooth surface. Over time, this repeated action can result in hand or wrist pain and injury. When sharpened incorrectly, look at the amount of metal that has to be removed in order to get back to the original design. If the instrument is allowed to get too dull, the cutting edge gets very rounded. This rounded cutting edge will not bite the tooth surface and engage the piece of calculus, resulting in burnished calculus. In order to get the cutting edge back to a surgically sharp edge, look at how much metal needs to be removed. This is lost metal that could have been used if the instrument would have been kept sharp all along. Now, let's look at what happens to the lateral surface when you are sharpening. If you don't stay at 110 degrees while sharpening the entire lateral surface, you will create bevels. Or another way to look at it is facets, like what you see on diamonds. The bevels are created because, as you can see, the stone has moved from 110 degrees to 90 degrees and greater than 110 degrees. Because it is difficult to maintain the proper 110 degrees throughout the sharpening process, bevels are created. An instrument with bevels on the lateral surfaces causes the operator to have to alter their hand out of the neutral position in order to get the cutting edge to bite the surface. This also tends to make the hygienist press firmer and harder. Doing this repeatedly can potentially lead to work-related injuries. In order to remove the bevels, the instrument requires recontouring to get it back to its original shape and design. As a consequence, a lot of metal must be removed, and it will take much longer to get this instrument sharp. Please pause to practice. Pause the video to take a moment to look for bevels on your instrument. Begin to assess how you are sharpening and what will be required to correct any errors. Why do we need to sharpen? Using sharp instruments is the primary way to prevent hand injury to the hygienist. Notice how this hygienist's wrist is not neutral. She's trying to close the blade in an attempt to get it to bite the tooth surface. She has to keep closing the blade in the attempt to get the instrument to adapt. This action, the closing of the cutting edge to the tooth in the attempt to get the instrument to bite the surface, is caused by a beveled edge and/or a dull edge. The repeated action of working with the wrist out of neutral and pushing too hard can lead to hand injury over time, and the patient will experience a heavy-handed hygienist. Therefore, train yourself to notice the minute you start to close the blade and/or push harder. Use this as a clue to stop and sharpen. When using sharp instruments, it takes very little effort to scale. Using sharp instruments allows for accurate scaling techniques. Large and small sandpaper deposits are not left behind when using sharp instruments and an accurate scaling technique. Sharp instruments gives the hygienist increased tactile sense to feel the tooth surface for fine and large deposits. When you can feel the surface better, you can remove the deposits with accuracy. With a sharp instrument, you are able to shave the calculus off and are less likely to burnish the calculus. The instrument on the left is sharp, resulting in a clean surface. The instrument on the right is dull or beveled, causing burnishing. Burnished calculus does not allow for complete healing and contributes to faster calculus reformation. A dull instrument has rounded cutting edges, requiring the hygienist to have to close the blade beyond the normal working stroke angle of 70 degrees in the attempt to get the cutting edge to bite the tooth surface. This causes the hygienist's wrist to come out of a neutral position in order to get the instrument to bite, and leads to burnished calculus. When the instrument is sharp, you're less likely to slip, causing potential harm to the patient or yourself. Using a sharp instrument decreases the time needed to complete a patient. The sharper the instrument, the more the hygienist can feel the deposits while scaling and remove them quickly and with accuracy. And a sharp instrument allows for a light exploratory stroke while scaling, decreasing the need to have to explore each and every tooth surface. In review, a sharp instrument allows for a lighter working stroke, leading to healthier hands. Notice how the hygienist is working with ease and very little pressure. It takes less working time for complete debridement, giving the patient the best care, and it allows for patient comfort, giving the patient a sense of a light-handed hygienist. There's less tissue trauma, leading to faster healing and little to no pain. and the operator will not slip, potentially cutting the patient or themselves. All of this builds the patient's confidence in the hygienist due to the light touch, ease of the appointment, and sense that a good job is getting done. Items you will need to sharpen your instruments. A sharpening stone. There are a variety of stones on the market. Be sure to familiarize yourself with the proper care and sterilizing recommendations for the particular stone you like to use. We will be using this man-made ceramic stone. The manufacturer recommends using water to lubricate this stone. Do not use water on the blue side of this stone. This is the side the 110 adheres to. You can spray a little water on the white side of the stone prior to use, or you can use the rubber band system to secure the 110 to the stone if your particular stone requires oil or water submersion to lubricate it. A test stick. You can use the test stick you can purchase or use the disposable hard plastic air-water syringe tips. A sterilized sickle scaler. We will be using the Nevi 49 from Hugh Freedy for our demonstration. The technique we are teaching can be used for all sickle scalers. In order to sharpen well and correctly, you will need good lighting, either your LED light on your loops or the operatory light. And finally, the DH Cube 110 sharpening device. Preparing to sharpen. First, let's become familiar with the instrument design. If you don't know the original shape, you cannot be sure you will maintain the integrity of the instrument as you sharpen. If you are unsure, always have a new instrument to compare your instrument to. We will be teaching you to sharpen the lateral sides of the instrument. This will narrow the face of the blade. Narrowing the face will cause the instrument to become thinner, allowing for access into tight areas. We do not recommend sharpening the face of the instrument or rounding the back of the sickle. This will cause the blade to become thin from the face to the back, causing it to become weak prematurely. Sharpening technique. When sharpening, small microscopic burrs can form on the cutting edge. The preferred method to prevent this is to finish sharpening using a downward stroke. Or you can use a cylindrical stone to lightly run over the face to remove the burrs. This is the only time we recommend using a stone on the face. If using the cylindrical stone, be sure to use a very light stroke so you don't take away too much metal, causing the instrument to thin and possibly break prematurely. When sharpening the lateral surface of the instrument, the angle of the stone to the face of the instrument is 110 degrees. When it is time to sharpen your sickle scaler like the Nevi 49 or the Montana Jack for the first time, you will need to remove the curved shape on the lateral sides before your stone can meet the cutting edge. Essentially, you will end up having to turn it into an absolute triangle in cross-section. It will take longer to remove the metal the first time in order to get a sharp cutting edge. Once you have adhered the 110 to the stone, shake it up to wake it up. The lights will blink on to indicate it is ready to go. Start with your stone perpendicular to the floor, tilt it away from the instrument's cutting edge until the lights turn on, indicating you are at 110 degrees. When the lights are on, you're on the 110 degrees. If they blink on and off or turn off while using it, you are not at 110 degrees. So your goal is to keep the lights on while sharpening. Often, hygienists don't realize they are not sharpening at 110 degrees. In an effort to resolve this issue, DH Cubed has created the 110. Many industry experts do not want you to hold the stone this way for fear of exposing your fingers to a contaminated instrument. So what you can do is hold the 110 either on the side so your fingers are clear of the stone, or you can hold it on the top, but you will need to use a barrier. One of the barriers that you can use is the barrier that you use on your light switch handle or your X-ray button. Just wraps on there. And again, you can hold it on the side, or you can hold it on the top, and you're ready to go. Another barrier that you can use is the barrier that you use on your light handle. Slips over, get the excess out of the way, and then again you could either hold it on the side or you can hold it on the top, keeping your fingers away from the possibility of exposure. Using the 110 sharpening device, we recommend holding the instrument in your non-dominant hand with the tip of the instrument facing towards your body. You need to be able to see the face of the instrument clearly in order to keep it parallel to the floor. Look at how the hygienist is holding the instrument and where each finger is placed for a solid grasp and a neutral wrist. The thumb is placed firmly against the handle in order to stabilize any possible movement during the sharpening process. You want to be sure the instrument doesn't wobble or shift while applying pressure during sharpening. When the instrument is not held correctly or firmly enough, it can shift, potentially causing bevels to form on the lateral surface. Look at where the thumb is located and how the fingers are not holding the instrument firmly enough. In order to prevent this, stabilize the instrument by using a firm grasp so that you won't shift due to the pressure used during sharpening. One way to stabilize your instrument is by anchoring your elbows against your body for stability. This will help prevent shifting of the instrument while sharpening. If seated, we do not recommend stabilizing your instrument on a countertop because it can make your wrists come out of the neutral position, potentially causing strain. Keep your wrists as neutral as possible to prevent strain or possible wrist injury. If you do anchor your wrist on the countertop, then stand up and lean over the instrument. This will straighten out your wrist. One end of the instrument will always cause you to bend your wrist. If you stand or sit to the side, you will reduce the possibility of wrist fatigue. Or you can stay seated, stabilize your elbow on the countertop, keeping your wrist neutral. This will have your instrument be at eye level. You can also switch the stone to your non-dominant hand to sharpen the opposite side of the instrument. Or you can keep the instrument in your non-dominant hand and flip the end of the instrument so the tip is facing away from your body. There are many ways to attempt to keep the wrist neutral. Use whatever works best for you. Maintain the 110 degrees as you move towards the tip of the sickle scaler. Do not turn the stone in towards the tip as you approach it. This will cause the tip to get thin and possibly break off. Or the tip will become short and not be able to adapt far enough into the interproximal, therefore missing calculus. This is why you want to maintain a straight path along the entire length of the blade, from shank to tip. The tip of the sickle should never be sharpened. If the end of the tip is sharpened, it will cause the instrument to become short and blunted, and again, too short to reach the interproximal well enough. Sharpen only 2 to 3 millimeters of the blade at one time. When doing this correctly, you will see a gap between the stone and the sickle at the tip end of the instrument. Begin to sharpen the first 2 to 3 millimeters of the blade at the terminal shank end of the instrument. Be sure to keep the face of the blade parallel to the floor throughout the entire sharpening process. You want to see the face at all times. This will require rotating of the instrument as you continue sharpening the cutting edge towards the tip. Begin sharpening the first 2 to 3 millimeter increments. Move the stone up and down in short, controlled strokes. The 110 will not work well when using long sharpening strokes. Be sure your elbows are firm against your side to stabilize both hands. Watch the 110 lights to be sure you are staying at the 110 degree angle. Eventually, you will be able to see the lights out of your peripheral vision and will only have to concentrate on keeping the face parallel to the floor. Sharpen this section of the blade until you see a black dust appear on the face of the instrument. Do not move onto the next 2 to 3 millimeters until you see the dust. The dust is an indication of eliminating bevels and dull, rounded cutting edges. Notice the amount of dust on the face of the instrument. It's not just a small amount of dust. You will begin to feel the cutting edge bite the stone when it's getting surgically sharp. Notice the amount of dust on the face when you begin to feel the cutting edge biting the stone. Once the dust appears, then move to the next 2 to 3 millimeters of the blade to sharpen. Sharpen this section until the black dust appears. Again, do not move to the next section until the dust appears. Waiting until the dust appears assures your blade is really sharp and that you have removed any bevels that might be present on the lateral surface and rounded dull cutting edges. If you don't sharpen until the dust appears, the blade will not be sharp enough to easily remove the calculus or be able to explore easily to feel for the calculus. And it will get dull much faster, causing a need to stop and sharpen more often. As you move towards the tip of the sickle, maintain the 110 degree all the way to the tip end of the instrument. Do not turn the stone in towards the tip as you approach it. This will cause the tip end to get thin and possibly break off in the patient's mouth. Or the tip will become short and not be able to adapt far enough into the inner proximal, therefore missing calculus. This is why you want to maintain a straight path along the entire length of the blade from shank to tip as you move the stone from the shank end towards your body. The tip of the sickle never requires sharpening. If the pointed tip end is sharpened, it will cause the instrument to become short and blunted, and again, too short to reach the inner proximal well enough. A common error hygienists make is to place the stone along the entire cutting edge. Do not place the stone along the entire length of the blade. This causes the instrument to become more pointed and prematurely too thin, and it will no longer be functional and could break off during scaling. The instrument on the left was sharpened in 2 to 3 millimeter increments, where the instrument on the right was sharpened with the stone along the entire length of the blade. See how the tip is thinner? Testing for sharpness. Before you test for sharpness, you first want to orient your test stick properly. Hold the test stick so it is shifted towards your body at an angle where you can see the face of the instrument being adapted at the working stroke angle of 70 degrees. For the other end of the instrument, again, hold the test stick so you can see the face of the instrument. This will require you to shift the stick away from your body so you can look directly down on the face. You want to see the face of the instrument at all times. Often, we are taught to test for sharpness by getting the instrument to bite the stick. But when you press hard enough, any instrument will bite the stick. The pressure required to bite the stick is the same pressure you will need to apply to the tooth. Therefore, the less pressure you have to apply to the stick, the less pressure you will need to apply to the tooth to get it to bite. In this video, the hygienist is applying a fair amount of pressure to get the instrument to bite the stick. This is an indication that the instrument is still fairly dull. Therefore, we recommend you lightly place the instrument against the test stick at the working stroke angle to gently shave the stick with the sharpened cutting edge. When at chairside, you can also check for sharpness by using the disposable hard plastic air-water syringe tip. Be sure to check the entire cutting edge from shank to tip. Looking closely, you can see the terminal shank end of the instrument is not shaving and is therefore not sharp. But at the middle section, it is shaving really well with little pressure. And at the tip end, it is shaving but can be sharper. When sharp, shavings will come off of the test stick. If dull, the instrument will slide around and slip. The same thing will apply to the patient's tooth. If slipping on the test stick, it will slip on the tooth as well, potentially harming the patient or you. When an instrument is dull, our tendency is to press firmer, hoping it won't slip, when in reality this is when it is most likely to slip. As you can see, this side of the sickle is not shaving the test stick, especially the tip end, which is barely shaving it at all. You don't want to make the mistake of only sharpening the dull section of the blade. This will, over time, alter the original shape. When you have a dull area, you must sharpen from the shank to the tip in order to maintain the original design of the instrument every single time you sharpen. It can't be emphasized enough. If you have to press hard on the test stick, you will have to push hard on the patient's tooth. This can cause hand fatigue and possibly hand injury, and the patient will experience a heavy-handed hygienist. A sharp instrument that shaves the test stick using very little pressure will shave the calculus off of the tooth with very little pressure. Therefore, you will be working more effectively and be reducing your fatigue. Please pause the video and take a moment to assess your instrument for dull areas on the cutting edge. Be sure to test your instrument for sharpness by shaving the test stick. Now, let's look at when to sharpen. When exactly do we need to sharpen? We've all been told at the first sign of dullness. Well, what does the first sign of dullness even mean? Let's look at it from a clinical standpoint. In this video, the hygienist is starting to press harder, using her thumb to apply more lateral pressure, potentially leading to hand injury. She's also attempting to get the instrument to bite the tooth surface by closing the blade. If you have to close the blade more than one time and press harder, you're getting to the point of needing to recontour your instrument, which will take longer than the 3 to 4 strokes per section of the blade to bring the instrument back to sharpness. If you find yourself pressing harder and/or closing the blade further and further, these are the first signs of dullness and clues to stop and sharpen. Don't cheat yourself by saying, "I don't have enough time to sharpen." This is the very mindset that will keep you from providing the best care to your patient and lead to potential hand injury because you are working too hard. When sharp, the instrument can give you tactile feedback of the root surface. You can be using such a light stroke, like an exploratory stroke, and be scaling the root surface. Very little pressure is required for the instrument to be removing calculus and root roughness. You can see how the hygienist is using a lighter stroke, not pressing so hard. And you can hear the sharp instrument against the tooth surface. A useful way to assess your sharpening skills is to always have a new, unused instrument to compare to. This will allow you to see and identify what the instrument should always look like. Again, your goal is to always maintain the original shape. The face will become thinner from lateral surface to lateral surface. But you can begin to assess what errors you may have made when getting the results, such as the instrument on the right. Can you figure out what may have happened when this instrument was sharpened? More than likely, the stone was turned inward while approaching the tip, and it also looks like someone sharpened the tip end. The tip end on sickle scalers should never be sharpened. The result? A shortened instrument, leaving it impossible to completely reach the interproximal, potentially missing calculus. When should we discard an instrument? It's not always easy to determine when to discard an instrument. This has always been a difficult question to answer because we all love our thinner instruments. If the instrument flexes at all by pressing it against a hard surface, like the countertop, discard it. If it flexes at all during sharpening, discard it. If it flexes while scaling, definitely discard it. You do not want the risk of the tip breaking off in the sulcus during use. Recap. Let's look at the key concepts to follow to be successful. 1. Know the original design of the instrument. 2. During the sharpening process, keep the face parallel to the floor at all times. 3. Do not place the stone along the entire length of the blade. 4. Sharpen only in 2 to 3 millimeter increments. 5. Sharpen until the dust appears. 6. Move on to the next 2 to 3 millimeter increment. 7. Sharpen until dust appears in this section. 8. Continue this process until complete. 9. Do not turn the stone in as you approach the toe, or the tip. 10. Sharpen as soon as you notice a dull edge forming to prevent hand injury. Don't allow your instrument to get too dull before you sharpen. Key concepts to follow to be successful. Let's review each of these key concepts. If you don't know the original design of the instrument, you will not sharpen correctly to maintain the original shape of the instrument. Dental hygiene instruments are technologically designed for us to work at our best, providing ultimate care to our patients, and support us ergonomically so we don't have on-the-job injury. If instruments are sharpened incorrectly or not often enough, all of that science has been eliminated, resulting in the hygienist having to alter their hand or wrist position, leading to on-the-job injury. In order to maintain the original shape of the instrument, we must first start sharpening by keeping the face parallel to the floor at all times. If you don't keep the face parallel to the floor, you will not maintain the shape of the instrument. You can cause bevels to form on the lateral surface, or will not get the correct angle to create a surgically sharp instrument. For every 2 to 3 millimeter increments of the cutting edge you sharpen, you will need to shift the instrument so you can look directly down onto the face to assure the face is parallel to the floor at all times. Because the sickle has 2 parallel cutting edges that converge at the tip, unlike the Gracie, many people make the mistake of thinking they can apply the stone along the entire cutting edge to sharpen it all at once, not in the recommended 2 to 3 millimeter increments from the terminal shank to the tip. When the stone is applied to the entire cutting edge at one time, the instrument will become more pointed and prematurely thin. This can lead to the tip breaking off in the sulcus. And it will require the hygienist to work harder to adapt the instrument to the tooth because the original design has been altered. Begin to sharpen the first 2 to 3 millimeters of the blade at the terminal shank end of the instrument. Again, sharpen only 2 to 3 millimeters of the blade at one time. When doing this correctly, you will see a gap between the stone and the sickle at the tip end of the instrument. Remember, this technique prevents the tip from becoming prematurely thin and possibly breaking off in the sulcus. Maintain the 110 degrees as you move towards the tip of the sickle scaler. Do not turn the stone in towards the tip as you approach it. This will cause the tip to get thin and possibly break off. Or the tip will become short and not be able to adapt far enough into the interproximal, therefore missing calculus. This is why you want to maintain a straight path along the entire length of the blade, from shank to tip. The tip of the sickle should never be sharpened. If the end of the tip is sharpened, it will cause the instrument to become short and blunted, and again, too short to reach the interproximal well enough. If you have to close the blade more than one time and find yourself pressing harder, you're getting to the point of needing to recontour your instrument, which will take longer than the 3 to 4 strokes per section of the blade to bring the instrument back to sharpness. If you find yourself pressing harder and or closing the blade farther and farther, these are the first signs of dullness and clues to stop and sharpen. Break yourself of the thought, I don't have enough time to sharpen. This is the very mindset that will keep you from sharpening at the first sign of dullness. Working with dull or poorly sharpened instruments is one of the leading causes of hand injury to the hygienist, and the best care is not being provided to the patient.